Rachel and I'm head of the All Wales Genetics Laboratory and consulting clinical scientist. So we've been developing a circulating tumour DNA assay, particularly for lung cancer patients, and we've very much been developing it in terms of being able to deliver a new service, clinical service to patients. We're really delighted with what we've been able to deliver here in Wales, particularly because of all the different people that we've been able to work with. So it's very much a really collaborative project and new service. So to begin with, we worked with trainees in the lab and then research projects. So we've had a couple of PhD students working on this. But we've been able to take it beyond the NHS laboratory, and we've worked across the School of Medicine. We've had funding from the Wales Cancer Research Centre, also funding from Stepping Stones, which is a Velindre charity. And I think the other thing that's been really great about the project is that we've been able to work with pharmaceutical companies as well. And AstraZeneca have been really great in supporting the project, in supporting us with our understanding about what we ought to be doing, but also financially supporting us. As a result of all this hard work over many years, lots of people getting involved, we were really delighted to be presented with a Medi Wales Innovation Award, which was really great. And I think the best thing about this was that we were given the award for capturing the spirit of innovation in the NHS.
I'm Charitable. I'm a pre-reg clinical scientist at the All Wales Medical Genetics Service in Cardiff. And my role is to implement new cancer research diagnostic tests into NHS services. Every cancer patient's genes will be different, and this can mean that they respond differently to different cancer treatments. And one of the things we do here is create tests to see how well a patient will respond to certain drugs. We've recently developed a new test for non-small cell lung cancer patients to see what kind of cancer treatments they respond to. And we've managed to do this without using patient biopsies. So we're using a simple blood test. So this is much better and non-invasive for the patient. As far as we know, this is the first test of this type that has been developed in the UK by the NHS.
So I'm Dr. Daniel Nelms, and I'm currently working as a registrar in medical oncology in Velindre Cancer Centre in Cardiff. I've just completed 3 years in the lab, taking a PhD in circulating tumour DNA. We are able to see patients in the clinic and take a simple blood test, which we are able to send to the lab for testing. This offers the benefit of improved turnaround times, less invasive test for patients, and also better access to more modern or newer targeted therapies. I have been helping in the management of patients with lung cancer who we have been using targeted therapies for, and they have been very keen and pleased with the introduction of this new blood test, as they are quite happy and willing to give blood samples rather than necessarily repeat biopsies. And for those patients who have had a positive result with the blood test and have had further access to ongoing therapies, are obviously very grateful, they're very satisfied in the service, and it's a further therapeutic option that's available to them, which they are benefiting from.